All righty, everyone. Well, thank you all for being here. Welcome. My name is Amanda Milstein. I'm a pediatrician practicing in or living in El Cerrito, practicing in Oakland and Richmond. And it is an honor and a pleasure, and hits very close to home to be having this conversation and talk with all of you today. So we are going to be talking about climate change and child mental health, and hearing from two phenomenal speakers who have lots of insights and experiences and depth to share with us, and then hopefully having some good time for conversation and discussion as well. Um, so without further ado, I'm going to read both of our speakers have long bios, so I'm going to share some of the highlights with you and then turn things over to them. So first today, we are going to hear from Dr. Chelsea Young, who is a board certified child, adolescent, and adult psychiatrist who practices in Marin County. She conducted a literature review during her child psychiatry fellowship at Stanford that has allowed her to continue to educate and continue to educate fellow healthcare providers about responding to climate change and climate anxiety related concerns in young people. She conducts advocacy work around building climate resilient schools with Climate Health Now, Climate Psychiatry Alliance, and 350.org. And she was also a contributor to the Climate Resilient California Schools, a call to action report that was published in 2023, and that is the basis of legislation that has twice now moved through the California legislature related to helping our schools be more climate resilient. So thank you, Chelsea, so much. It is also an honor and a pleasure to introduce Reverend Talitha, who is a chaplain at UCSF Benioff Children's Hospital, Oakland. Say that 10 times fast, and the author of a book called In Deep Waters, Spiritual Care for Young People in a Climate Crisis. She is a Presbyterian minister. She's worked with the young since she was old enough to be qualified as a chaperone. And she specifically speaks from her experience working with young people at the intersection of the climate crisis and their own spiritual and existential crises and journeys. And she's also newly the chair of UCSF Benioff Children's Hospital Oakland's Green Team, of which I am a very proud member. And so she wrote here that she's learning how to create change in an institutional setting. I think we're already making change in an institutional setting. So with that, I am going to stop my share and turn it over to Chelsea.
Great. Thank you so much. And I am going to share hopefully just the slides, but please let me know. Okay, having a little bit of
yeah, that's perfect, Chelsea, what you just
okay.
said. Yeah.
Okay. And I may need to skip over some that were supposed to be hidden, so I apologize for that, but let me try to get rid of that. Okay, thank you, everyone. I'm going to put that down there. So thank you, Amanda, for that introduction. And I'll be speaking today about the impacts of climate change on children's mental health. Primarily today, I'm focusing on climate anxiety. This is a version of a talk that I gave 2 years ago for NC ROCAP, a group of psychiatrists that I've adapted. My name is Chelsea Young. I'm, like Amanda said, a child and adolescent psychiatrist. I do a few different jobs, and climate work is my hobby. So I work in private practice here in Marin, and I also work as a consultant for the Redwood Coast Regional Center, which is Eureka up to the Oregon border, where I see kids with developmental disabilities who are primarily on public insurance. So we have a mix of patients, but I am now 100% clinical. So I do talk to a lot of kids about big feelings and worries, and that was the inspiration for me getting into this kind of work. I work with kids as young as 4 up to about age 24. And I have no disclosures or conflicts of interest. And these are my objectives, which I won't read each one because we hope to leave plenty of time for discussion if possible. So I don't have to preach to the choir here. I know there's a lot of pediatricians as well as psychiatry folks of the disease burden of climate change. The vast majority, or 88% in one review, will affect today's youth. And so you all know better than me that children are more vulnerable to the effects of climate change for a variety of reasons, which I won't go into fully, but they have different physiologies. They're much more sensitive to heat. They're still developing, so they have windows of extreme vulnerability. They have more exposure to toxins and more sensitivity to toxins. They spend more time in the dirt and water in those, vulnerable environments. They have more future years of life when the climate will be overall much warmer. And they're finally dependent on caregivers, including politically. They don't have a voice. So I'm sorry, I'm going to skip over these. So then when we think about the mental health effects of climate change, it's really vast. Climate change, as we know, affects all areas of our life. Mental health impacts can be grouped into different categories. So obviously there would be direct effects such as PTSD if you survive a traumatic event where your life or the life of one of your loved ones is actually in danger. There can be, the direct effects from heat, such as increased aggression or suicidality. Then there are indirect effects like disruption to routines, forced migration, for example, missed soccer games due to poor air quality. So all of those affect the kids, psychological development. There are then physical health comorbidities that would have mental health consequences, like an increase in vector-borne illnesses or diarrheal illnesses related to, contamination of the water supply due to flooding, that can then lead to alterations in brain development or nutritional deficiencies. And then the last category, which is kind of where I'm focusing today, is psychological distress just from the awareness of kind of the impending or currently here climate crisis. And so this last category I think of as being somewhat synonymous, or at least including, climate anxiety, where I'm going to focus. And so on another day, maybe I can give my talk related to the other buckets of mental health effects. So I like to start with, patients. So again, I'm entirely clinical now, like I said, so I do talk to a lot of kids about their different worries, and I'd be curious to hear about other people's experiences at the end. But my patients, they do struggle with climate anxiety. It is definitely almost never the chief complaint, but it certainly comes up in subtle ways. So for example, a couple that stood out to me, I had a 9-year-old male when I was in fellowship with ADHD and anxiety, and he shared that, he loves Arctic animals, and he was really worried that they are dying off, and this was keeping him up at night, and he hadn't even mentioned it to his mom, but it was a big concern for him. And then another one that really stands out is when I was in my early in my private practice, I had a 15-year-old in Santa Rosa. She was extremely bright, and she'd been already evacuated twice from her house due to nearby wildfires. And she presented with a mix of OCD, anxiety, and depression. But she was somebody that I did talk about climate anxiety, because that was also a big part of her distress. So she was kind of one of the few where it was more of kind of her one of her chief concerns, and then she had kind of her other DSM diagnoses. And then finally, as child psychiatrists, we love to ask kids about their 3 wishes. Like, if you could change things in your life or in the world, what would you wish for? And many of my patients allude to, based on their developmental stage, like carbon dioxide, global warming. Some talk specifically about like plastic pollution. So depending on their understanding, it can really vary, but certainly environmental degradation is a big concern. So I always like to start by pointing out that the term climate anxiety or eco anxiety, in reality, it's not just anxiety. It often, for these kids, includes a mix of feelings, fear, worry, depression, helplessness, rage, and then solastalgia, which was coined by Glenn Albrecht in his book, and then he wrote about it in his book Earth Emotions, which is the kind of environmental degradation causing your home to be unfamiliar to you. And then there's another term from the climate community is pre-traumatic stress, knowing that there's an impending disaster coming and that you won't be able to prevent. So there, all of these things are involved, included, but climate anxiety seems to be more mainstream in the media. So I'm fine to use that term. And then, eco anxiety, we can have others weigh in as well, including like Robin Cooper is here. But for the most part, it seems like a lot of people use it, synonymously. And the handbook is synonymously with climate anxiety. So in the handbook of climate psychology, eco anxiety was defined as a heightened emotional, mental, or somatic distress in response to dangerous changes in the climate system. And they really emphasize that paying heed to what is happening with the climate is a healthier response than turning away in denial or disavowal. And then the American Psychological Association, and it's referenced here in the handbook, coined the term eco-anxiety in 2017, and they defined it as a chronic fear of environmental doom. So those are two kind of working definitions. And then, I like to point out that climate anxiety is often felt more powerfully among young people who perceive that there is going to be this big impact on their future. Also first responders to natural disasters, climate scientists, and activists. So those are folks who are, particularly affected by this phenomenon. And then in the handbook of climate psychology and also in other resources that I've looked at, we really want to differentiate between pathological and more adaptive forms of climate anxiety. So climate anxiety itself obviously is not a DSM diagnosis. So it's really about like how the person is managing it. So denial and inaction would be considered, maladaptive response to climate anxiety, as would climate nihilism or, numbing yourself with substance use. An adaptive response would be to accept the negative feelings and take action in a balanced way. So again, we don't want to pathologize what is really a normal response to a very scary situation, an intolerable situation. But we definitely do want to help those young people who are debilitated by feelings of climate anxiety. And another way to look at that, Maria Ohala is a researcher who looked at coping responses to the climate crisis in youth, and she identified different groups of young people with different coping styles. So she pointed out, or kind of categorized them as problem focused, emotion focused, and meaning focused. So problem focused would be like you see a problem and you kind of take, action such as recycling or, other like direct actions that are pro-environmental. And this can also include educating yourself about the problem, etc. But she points out this can come at the expense of actually processing the feelings and taking the most meaningful action, like looking for those more societal changes that we need. In emotion-focused coping, this typically involves de-emphasizing the threat, where somebody might feel completely overwhelmed by the fear of the climate crisis, and just kind of avoid thinking about it, or Or that's where we might see the nihilism, like, well, it's too late to change anything, so like, why should I care? Um, so Maria Alhala um, says that, meaning focused coping is the most healthy and productive, where we're really helping young people to experience both the negative and positive emotions and accept their negative feelings and anger and whatever it is, that they are feeling, but also take collective action at the same time to work for larger change. And she points out that meaning focused coping may involve spirituality or trust in a greater good. So just to reiterate that, we may have three different young people experiencing climate anxiety, but one, for example, may seem to be coping well by like really focusing on their own carbon footprint or things like that, but may be experiencing a lot of symptoms of panic or insomnia. One may be taking collective action with a group of like-minded peers and accepting their negative feelings, and another might be totally avoiding thinking about it and maybe using marijuana to numb their negative feelings. So people can really respond in different ways. So getting more into prior surveys that have been done. Again, climate anxiety and eco-anxiety are terms that are not very old. It's a relatively new concept. So what do we know about it? There was a really great study published in 2021, and Caroline Hickman and colleagues surveyed young people between the ages of 16 to 25, so not just kids, these included young adults, from 10 countries, including the US and UK, but also Philippines and Brazil, so kind of a mix of, developing and developed countries. And the results were heartbreaking, but not unexpected based on prior results in the US, which I'll cover next. So as you can see from the headline, the prevalence of climate anxiety symptoms among young people is quite high worldwide. This got a lot of good media coverage. I know this is a tough slide to see, but this was looking at just how people are feeling about the climate crisis and what kind of, if they agreed with these specific statements. So if you look at the average from all countries, like 39% are saying I'm hesitant. That's this first column. 39% are saying I'm hesitant to have children. 55% agree that humanity is doomed. The highest, I think, is 75% agree that the future is frightening. So people are, these young people are really struggling. And then sadly, a majority agreed that when I try to talk about climate change, other people ignore or just dismiss me. So 40% said yes to that. And then another 18% said, like, I don't even try to talk to people about it. So people are, feeling alone with these really negative feelings. And then the countries where there are, more effects from climate change, you can see in the surveys that like Brazil and the Philippines, those were the got kind of the most negative responses. And then same paper, the purple is representing people who feel that their country, their government is reassuring in terms of their response to climate change. So purple would mean reassuring. Again, this first one is like all countries, these 10 countries. And then the pink bar, which is higher in every case, indicates that, the majority feel a sense of betrayal from their government for their lack of action on climate change. So the authors of this paper, including some who are part of the Climate Psychiatry Alliance, conclude subjecting young people to climate anxiety and moral injury can be regarded as cruel, inhumane, degrading, or even torturous. So they're basically, advocating with that statement to use the judicial system to kind of continue to force climate action for these governments where their constituents feel like they're being abandoned due to lack of action. So that was a great study. And again, that was teens and young adults. And that was, fairly similar to this prior survey by the Washington Post and Kaiser Family Foundation that was done in 2019. This was 629 teens in the US, ages 13 to 17, randomly selected from across the US, and the interviews were conducted by phone. And those results show a majority of teens feel afraid and angry, at 57 and 52%. So considering this in the Hickman study, I think it's pretty clear that kids are feeling threatened and afraid, and they feel like people in power really aren't doing much to help them, can't or won't help them. And then you can see only 20% say they, at this time, said they were uninterested in climate change. So this kind of suggests to me that, there is interest and kids care, and I think adults should really, be doing more to support them. Whoops, don't know what this random Y is. So similarly, there was another survey of 1,200 teens and young adults by Blue Shield and Next Gen Climate. This was in 2018 maybe. And 83% of respondents said they were concerned about the health of the planet. 75% perceived some impact on their own mental health. That's this one. So again, around 2/3 of young people feel in this question, they said their own parents do not take the climate crisis seriously. So they can't even necessarily go to their own parents for support. So again, teens left alone with these feelings of intense distress and negative consequences for their mental health. And then this is, I'm almost through the prior research. This is a qualitative interview study that I like. Now it's nearly 15 years old. And it was 50 fifth graders in an urban area of Colorado. And a majority, this was, I guess, mixed methods. So they did some quantitative work. 82% of the kids interviewed reported fear, sadness, and anger when discussing environmental problems. And then you can, read these quotes. I feel sad because when I die, I'm probably going to have a grandson or great grandson by then, and maybe their son or nephew is going to experience the end of the world. That's really sad. And again, not so much now, but when the term was first coming up, a lot of people used to argue that climate anxiety is like a rich person's problem or a white person's problem. I'll just point out the kids in this particular study, because they did have the demographic data, they were not rich. The majority were under or around the poverty line, and only 2 of them made over $100,000 per year. So I think it's safe to say that even if the terminology that people use is different, like kids from many backgrounds and different countries from the Hickman study, are experiencing climate distress. And then lastly, this is not a scientific study, but I like it because child psychiatrists like when kids draw pictures. So this was a journalist in Europe, and she had 50 kids, I think, draw. In 2017, kids between 6 to 12 draw what they expected the world to be like in 50 years. And according to her article, kids are drawing mostly apocalyptic images, like a sea level rise, and then we're all like blasting off to a different planet because we've destroyed Earth. So that concludes the prior research, and that's not an exhaustive review necessarily. But I'll just mention in closing some of my own thoughts and experiences with this. And this slide is based on a great paper by Elizabeth Pinsky, who's I think, triple board child psychiatrist and pediatrician at Harvard who does a lot of great work. So she wrote a great paper in 2020 where she went over like approaches to climate anxiety by developmental stage. So remember when you're talking about the climate crisis, like kids in preschool can't necessarily grasp, the scientific background with climate change, and that they think very egocentrically, and they may interpret parents' distress or even natural disasters as being somehow caused by them or their fault. So they may need reassurance that they're not to blame. For example, I caused that wildfire because I drove in a gas car, would be simplistic response that could come up. So yeah, just kind of meeting them where they're at. And I find that, for younger kids, picture books can be extremely helpful and kind of simplifying things, obviously. So for school age, but not avoiding talking about it. I think it is good to talk about it because they do pick up on everything. For school age kids, their biggest fear is separation from caregivers. So providing some reassurance that whatever happens, they'll be with you or you'll protect them to the best of your ability. And then they can obviously start to get more engaged in activism or community service, particularly like in groups with peers or with caregivers. And then obviously for teens, like validate, their emotions, try not to dismiss whatever it is that they're feeling, try not to problem solve for them, let them come up with their own solutions, and you're just there to be a sounding board and support them. And then encouraging them to find communities of like-minded peers. And this is just a list of children's books. Mostly it's books like picture books for younger kids, but there's a couple of books for older kids there too. My favorite is Fur and Feather Band Together by Dave Griswold. He's a local author. It's a beautiful book.
Yes, Fear and Feathers.
Yeah, Fur and Feather. It's so great. You know him, right? I think, Robin, or you've met him. And then, yeah, assessments are lacking. I don't use any particular assessment. There was one from Clayton, but it's for adults. But, in the paper, she does write that it could be used for kids like over 12. So I don't know. I mean, what I do in my practice, I kind of weave it into my anxiety screen, even though it's not a DSM diagnosis. I'll still go through like, are you somebody who tends to worry about the future? Worry about bad things happening to loved ones, worry about natural disasters or climate change. And then if they say yes, then I'll kind of follow up. So that's just what I've, started to do over the last couple of years, and I find it helpful. And then what is our role as someone working with patients coming of age in a climate crisis? So for my 15-year-old patient from Santa Rosa who did have climate anxiety, just kind of making space for that, validating it, without oversharing about obviously myself and my interests. I think that helped her. And then we did for that particular patient, because it was one of, the main things she wanted to bring to me. We did think together about whether maybe there was an existing group she could join at her school or start something, or how she could get involved in some kind of collective action. And I did talk to her about doom scrolling on social media, because that certainly can be really distressing for kids who are already affected. And then I want to end so that Talitha can do her part, but I think that, yeah, another piece that I feel pretty passionate about would be like schools getting more involved somehow. So, having climate resilient schools, and then having teachers feel more confident somehow in supporting kids when these feelings do come up. And just, training them so they feel like they can respond. So here are ideas of how to get involved if you aren't already involved, although I'm sure many of you are, as Greta Thunberg and Naomi Klein say, to change everything, we need everyone. And that includes all of you and your special skills. And thank you so much for listening, and happy to hear about all of your experiences when we if we have time for discussion. Thank you.
Thank you so much, Chelsea. That was awesome. And we'll share stuff out with everyone who registered as well, including that awesome list of books. Talitha, I'm going to turn it directly over to you, and then I think we'll open up to discussion after we hear from you.
Sounds great. Let me just get this presenting. It was very nice of PowerPoint to kind of change how these things work right before. Okay. But I'll be talking about this spiritual care and the climate crisis, which is a different lens and a different discipline, but hopefully enlivening and interesting for everybody to hear about it, whether spiritual care is part of your work or not. Just a brief outline. I'll be talking about the role of a chaplain, what spiritual crisis is, and give you a model for understanding that, and finally, kind of the attitude required to approach these things. I know this is the medical community. Probably most of you have worked with chaplains, but just in case you haven't, I want to make sure we know the basics that chaplains, professional chaplains, are trained and certified, and we go through a lot to work on our skills and craft, that we are not to proselytize, evangelize, or in any way try to make people more religious than they are, and that we are professionally trained to provide supportive listening to people of all religions and none. So just the basics there, to make sure we have everything correctly identified there. So spiritual crisis does not necessarily mean a crisis where the person is talking about spirituality a lot. I define spiritual crisis as when somebody ends up in a kind of, it might feel spiritual to them, or it might feel existential to them, but a crisis around the things that are really important in life. A crisis in their ability to make meaning, a crisis in their ability to feel what goodness might be. So there's different ways it can manifest, and we'll be talking through different ones of those. I use the spiritual assessment and intervention model, and this was not specifically developed for or tested on children, but it is a established spiritual care intervention model, which is helpful, and I find it's a useful frame, even though it's not specifically oriented to pediatric patients. So these are three spiritual needs, and kind of three spiritual areas. The first is the need for self-worth and belonging. Somebody who has this need well met kind of has a good, healthy sense of that it's good to be me. I know who I am. I know that I belong in the world and in my community. But somebody with this need not well met might be asking, do I matter? Does anybody care? What do I have to do? They will probably be very focused on actions that they can take to prove their goodness to others. And that might be personal about yourself, but when it comes to the climate crisis, I also see it extending to your sense of self as a human, and so your sense of who humanity really is, which is if a person might lose their sense of like, I am good, a person experiencing it ecologically might be experiencing, are we good as humans? And I like to tell this story of a young child in a Sunday school class that I was teaching when I was a pastor. And the teacher had told the creation story, the one that has the rhythm of the 7 days. And they got to day 6, and God created human beings. And the child just spoke up and said, well, that is the day that God made a mistake. And went on to say, like, if God had stopped on day 5 with the fish and the birds and the other, innocent creatures, then we would not have climate change, and the world would not be as trashed as it is. So while your average faith community might be kind of focusing on the first questions that are like more personal, the children are wrestling with this question of like, what are humans? We are humans. What does that mean to be human in a world where we've seen the bad that humanity can do? And I also want to name that this is, when it comes across as sadness or grief, that it's a disenfranchised grief. We don't have rituals for it. We don't have communal processes that we go through. And so it can be very isolated. So that was the first spiritual need. Then we go on to the second core spiritual need, the need for meaning and direction. And somebody who has this spiritual need well met knows what's important. They know what their values are. If it comes to making decisions, they might not know what they're going to do ahead of time, but it will seem a little easier because they have their orienting and grounding principles solidly in place within themselves. Versus if it's not well met, they might be wondering a lot, well, what is important? How do I decide what matters? What is worth my energy? And my personal favorite, why the bleep am I recycling? Like, the world is on fire and here I am separating my recyclables. Just the ability to have clear, like, I know what to do. I know why I'm doing it. I have like my motivation for the good I can do, and a sense of perspective about it too. So when this spiritual need is not well met, it can come out in kind of different ways. Somebody might start to feel kind of paralyzed, like they wouldn't take any action because they don't know which action to take, kind of in a fog perhaps, or paralyzed. And then on the other hand, it could lead to taking really extreme kind of all or nothing action. And I think of like the teenager who went vegan very suddenly without really knowing how to cook for herself or anything like that, just and could keep it up for a couple weeks, but she was going to save the world by going vegan right then. So these extreme actions can be evidence that the person is not well grounded in their perspective on what is most important to them. And the third core spiritual need is the need for reconciliation, to love and be loved. Somebody with this core need well met is somebody who has mutual, supportive, trusting relationships, who can, share some vulnerability without being swamped in shame by it, who is secure, who knows how to say no if they mean no, and has good relationships with people around them. And this can be, when it's not well met, there can be a lot of different kinds of relationship disruption. It might come out in hurt or anger or kind of dysfunctional relationships where people don't get their needs met or don't have appropriate boundaries or can keep themselves safe. And the spiritual aspect of this might come down to things such as asking for forgiveness when we have hurt somebody, or offering forgiveness, having accountability, and self-awareness of like, what is my part in this conflict? So those are kind of the aspects of these relationships. And I've seen teenagers really blow up their friendships when somebody was not making the same ecological commitments as they were. And I've also seen it very dramatically across the generations when your grandmother doesn't, quote, believe in climate change. That's an enormous betrayal. And it makes it hard to imagine continuing in relationship at that way. And as Chelsea pointed out, there's like a lot of children have a lot of big feelings that they don't see other people talking about them. There's just so it can be so overwhelming as a child or a young person to be taking in the climate crisis. And when they see that grandma like literally is not even interested in talking about it, it feels like a betrayal and a break in the relationship. So those are kind of the three areas in which somebody might present with a spiritual crisis. And chaplains can intervene in various different ways. I want to also share this one very helpful tool, the Climate Emotions Scale by Isaiah Hernandez, who's Queer Bound Vegan on Instagram. And they share this Earth Emotions Scale, which kind of just gets a little more granular, a little more specific. It's like, it's not just happy, sad, angry. There's flavors of experiences that people might have, like the eco anxiety is one, eco guilt is an important one, eco rage. Chelsea mentioned solastalgia, which is like when you're nostalgic for the home that you're still in because it's changing. And soliphilia is like how you love your place and feel connected in a mutual way with the place where you live. So these are helpful. I think a lot of young people are experiencing earth-based emotions in a powerful way, and giving words to them helps a lot. But I also think of just helping them connect with others. I brought a group of teenagers to a climate protest, and one at the end said to me, "Wow, it was just good to know that I wasn't the only person who was angry." She was carrying anger within herself, but when there's a huge crowd yelling in the streets, she was like, "Oh, this is I'm not alone in this," and it was immensely meaningful to her. I'll just end with a personal note. This group here is the youth group that I used to pastor before I became a chaplain here. And we were headed on a retreat, and these are our very first N95s. It was 2018. And the air quality was unbreathable, but we were trying to take a trip together, and we did not want to cancel it. So we were driving out of the Bay Area to find clear air for the weekend. And in that minivan that you can see behind the youth group right there, I was a driver, and there were a couple of them were sitting in there with me, and they just started talking. They talked about how could God really be involved in this, the climate crisis. They had
Did Talitha just freeze for anybody else? Uh-oh. Talitha, you froze. Okay. I feel like we were just, this was very important what she was about to tell us. Okay. Let's see. I think, let's see.
I am back. I'm very sorry.
Okay.
Ooh. Did you hear me start to tell this story?
Can you, yes, we heard up in, yes, you were cut off of maybe a sentence. Yeah, how can God do this? That was, I think, what we last heard. Oh no. Zoom.
Yeah.
Oh, okay. Can you, let's see, try it one more time?
The conversation was very transformational for me. And it changed the way I saw things. I had been hiding behind some naive, hopeful, spiritual bypass that let me say that, we're in a mess, but we'll get through it somehow. And the children made it clear to me that if I wanted to be their pastor, if I wanted to be in that kind of intimate spiritual relationship with them, that I had to take the climate crisis more seriously. I remember after that conversation, I did my research and I came back with like a list of theologies. Like, this theology could explain how bad things happen while God is still good and things like that. And one of those kids just didn't even really look at me, but just kind of like got my attention. It was like, so I could believe any of these except the ones where you think the climate crisis is going to get fixed, because it's not, and kind of just stared me down on that until I came to agreement. And that was transformational and has really made me switch my attitude from the attitude of let's try to avoid a catastrophe to the attitude of let's try to make the best possible catastrophe for the sake of the people that we live with and care for, and for the sake of the world, and to kind of embody a different and grittier motivation. And I use the word motivation rather than hope, because hopefulness, especially in spiritual terms, can be very naive, but I can be motivated. So anyway, that's my share. Thank you so much for being here.
Talitha and Chelsea, thank you both so much for sharing all of that. I just will highlight, I put the link in the chat, but I cannot recommend Talitha's book highly enough, truly. So I think it is worth reading for anybody. So I would encourage everyone to check it out. We have 11 minutes to go. We have a few slides that I do want to show at the end that are along the lines of, well, what can we do about any of this? Because I don't want I very much feel it's sometimes hard to take all of this in and then feel like, well, what am I doing? But that will only be a few minutes at the end. So I wanted to open it up to see if anyone has a reaction, a comment, a question, or feel free. I know there's some good stuff going on in the chat also. And you can just come off of mute.
I'll just make a comment. This is Robin Cooper. I wanted to thank both of these presenters. And as I listened to the both of them, it occurred to me just how profoundly interconnected the thinking and ideas in the religious and spiritual sector complement and are really a different way of saying the same kinds of things that we experience in the realm of mental health and climate change. So I so appreciated that.
I'm curious for the audience, who I think we're fairly pediatrician heavy, but not only pediatricians. Has anyone had experience clinically? Yes, they are bullshit sectors. Has anyone had experience clinically or outside of clinic talking to kids about climate change? I'm curious to hear how that's what folks can share.
I'll just share a little bit. This is Ethan Sims, who I'm an ER doctor in Boise, Idaho, and founding member of Idaho Clinicians for Climate and Health, the Medical Society Consortium for Climate and Health's state chapter in Idaho. And I have two teenage daughters. And the comment I made is something that came straight from my 16-year-old's mouth. She just joined our city's Youth Climate Action Council and is becoming very involved, hopefully out of her own interest and not because she's trying to make her dad proud. Her complaints are really that adults especially older adults, turn and look at her and say, well, it's your job now. And she's like, I have no money. I have no power. I can't even vote. How is it my problem? Like, you can't tap out as an adult and say it's the young people's job to fix. That leaves them even more hopeless and even more full of despair. And I just feel like kids need to see us lead on this, see us try, and not just talk about it as a problem. Like, I mean, we're barely even acknowledging it as a problem as adults in this society. But asking kids to lead on this is not fair. I mean, I think it is our responsibility as the ones with the resources, as the ones with the voting rights, to lead on this.
Yeah, I totally agree. I think like when you're, encouraging kids to take collective action, for example, that's more so that they can find the like-minded peers and find a sense of meaning. And the messaging, I completely agree, should not be like, go fix it, and I think that as like myself, as a parent of, 3 young boys, I really try hard to show them like, these are the things that we as a family are doing, and these are the, the things that I'm doing as your mother to try to protect you from this, and go to rallies together when we can and things like that. Because I think that's really missing. Like, kids feel like there's this huge threat, like something really bad is coming at me and mom doesn't even know what's going on. Like, that's a very uncomfortable feeling. But thank you, Ethan, for all your work and your comment.
Yeah, I agree. The positive action is kind of, it shouldn't necessarily be with the we can save everything, kind of like, if you do positive action, then you will save the world. That won't happen, but you will feel better if you take positive action is true. And there are positive actions that can make a difference. I kind of try to use the metaphor of the steamer Carpathia, who responded to the Titanic going down. They did not save everybody, but every minute they shaved off by pushing faster to get there saved a life. And so any little bit you can do or help could be a life that you save.
Okay, well, I'm going to use that as our transition into just some things we could do. This is obviously not exhaustive, but I'm going to share 2 things if people are feeling called to do something. And so let me just get back into presentation mode here. And then also say, if people on this call are interested, Chelsea and Talitha and I were floating around the idea of like, is there a need or a desire for more space to discuss some of this, either wearing our health hats or not. That's something that I think we're interested in pursuing. So if folks have ideas, I'm going to send a follow-up email. And then if folks have ideas for a space they would want, or help, or something in particular that they would want, we're really interested in hearing that. But I'm going to share 2 things. This is both from Climate Health Now, and then at the very end, I'm also going to share a little bit about our AP chapter. Climate Health Now is accepting applications for what will be our 2nd year of our Healthcare Sustainability Fellowship. You can scan this QR code to get to the application. Probably I'm preaching to the choir here, but if you don't know, the healthcare sector in the US is 8 to 10% of our greenhouse gas emissions. If we were our own country, we would be the 13th largest emitter. We are part of the problem, but I think also part of the solution. So if you are interested at all in sustainability, making your healthcare workspace more sustainable, we want to help and know about you. So please take a look at that QR code, reach out with any questions. That's happening right now. And Also happening right now, or happening this week. So there's a lot on our ballots. I think probably by now all of us have received our ballots or will this week in the mail. There's a lot on there. One thing that Climate Health Now is working on is getting the word out about Proposition 4, which some people are calling the climate bond, which would go very far toward funding more preventative action in California in terms of responding to climate disaster. We have an info session coming up on Friday at 12:30 that is basically understanding Prop 4 through as a health professional, as a part of the health community. So if that calls to you, we would love to see you there as well. And then last, but certainly not least, and we're going to actually give you back, I think, 2 minutes, which is amazing. Thank you all for being here. I think this is can be a hard topic to hear and think about. I know it is for me. So I really appreciate that folks are willing to listen and take this in and think about it. If you're not a member of Climate Health Now and you're interested in joining, we are a group for the California health community, defined very broadly. And we work on legislative advocacy, we work on healthcare sustainability, we offer general education events such as this one and more. We'd love to have you join. Also, our AAP chapter, which is American Academy of Pediatrics, California Chapter 1, which is a co-sponsor of today's webinar, has a climate change and child health committee. You can scan that QR code to get added to our listserv. We're always looking for new people who have ideas and enthusiasm and want to get some stuff done with AAP. So I will stop with that. I'm going to share these. Oh, thank you, Shwen. Yes, and Janet, you said you can join the Sustainable Schools Initiative. I'll see if I can drop that link in the chat as well. There's so much to do, not a shortage of things to do. The Climate Ready Schools Coalition, that's this. All righty, everybody. Well, thanks for being here. Yeah, please reach out and we'll follow up with us all the things that were shared out.
Great to see people, some of whom I know and many who I don't. And now we've been together for an hour. Thank you. Really great.
Talitha and Chelsea, especially, thank you for sharing your insight and wonderful people generally. And thanks AAP California Chapter 1, Yolanda, for co-sponsoring this. All righty, take care, everybody. Bye.
Bye-bye. Have a great day.